Good morning, dear students. I'm Dr. Shweta. I'm a senior lecturer in Oral Medicine and Radiology Department, BBDCODS. I will be taking your lecture on HIV and AIDS. So, coming to the contents, we will be covering introduction, history, epidemics, characteristics of HIV, synonyms, pathophysiology, transmission, clinical staging, ECC clearinghouse classification, evaluation, treatment, and coming to introduction, the human immunodeficiency virus is an enveloped retrovirus that contains two copies of a single-stranded RNA genome. It causes acquired immunodeficiency syndrome, AIDS, that is the last stage of HIV disease. It is mainly characterized by opportunistic infections and tumors which are usually fatal without treatment. It is a disease at least moderately predictive of a defect in cell-mediated immunity occurring in a person with no known cause for the diminished resistance to that disease. So, history, it is discovered independently by Luc Montagnon of France and Robert Gallo of US in 1983-84. It is HIV-2 is discovered in 1986 in West Africa. Scientists generally accept that known strains of HIV-1 are most clearly related to the simian immunodeficiency viruses, which is endemic in wild ape population of West Central African forests. So it is most commonly derived from the apes, which is found in the German and Dutch colonies of Cameroon. So, scientists believe that HIV came from a particular kind of chimpanzee in Western Africa. Humans probably came in contact with HIV when they hunted and ate infected animals. Recent studies indicate that HIV may have jumped from monkeys to humans as far back as the late 1800. The government of India estimates that the about 2.40 million Indians are living with HIV with an adult prevalence of 0.31%. Children less than 15 years account for 3.5% of all infections, while 83 are in group of 15 to 49 years. Of all HIV infections, 39% are among women. So these are the characteristics of HIV. It has a structure which consists of P17 nucleic acid genome, which is RNA genome, reverse transcriptase enzyme, integrase enzyme, lipid envelope. Synonyms: this HIV is also called as human T cell lymphotropic virus, lymphadenopathy associated virus, AIDS associated retrovirus. Now coming to pathophysiology, it's very simple and we can understand by the flow chart. HIV attaches to the CD4 molecule, virus surface fuses with cellular membrane, entry into T helper lymphocytes, HIV provirus forms, which follows the transcription and viral mRNA production is initiated. After this, the HIV structural proteins are made and then viral budding from the host cells are done, which causes the millions of HIV particles to be released and infect the. Now coming to transmission, we will be knowing this. This is unprotected sex with an infected partner, sharing needles with infected person, transmission from the mother to fetus, and infection from the blood products. This figure you can assume how it entered the body. Now, what is the clinical staging of AIDS? The stage 1, stage 2, stage 3, stage 4. Stage 1 is asymptomatic with no symptoms of HIV disease, which is short flu-like illness which occurs 1 to 6 weeks after infection. And stage 2 is mild symptoms, average 10 years, and HIV in blood drops to very low levels. And in this, antibodies are detectable in blood. Stage 3, where advanced symptoms of AIDS can be seen, the immune system deteriorates, opportunistic infections start to appear, and the stage 4 severe symptom of AIDS, which is caused by the rapid decline in the number of CD4 cells, and opportunistic infections very severe, and hence it can cause cancer too. Now this also stage 1 where the CD4 unit cells are, it is more than 500 to 600, and stage 2 it is between 350 to 500 cells. Stage 3 it is 200 to 350, and stage 4 the cells are less than 200. Now, for the oral lesions, we have an ECC clearinghouse classification. So it is grouped into three. Group 1, which is most commonly associated with HIV infection like oral candidiasis, pseudomembranous candidiasis, cheilitis, oral oral hairy leukoplakia, linear gingival erythema, necrotizing gingivitis and periodontitis, and non-Hodgkin's lymphoma. The group 2 is consists of lesions less commonly associated with HIV infection, and group 3 lesions are associated with HIV infection like recurrent aphthous ulcers, molluscum contagiosum, lignite reaction, facial palsy, and erythema multiforme. Other opportunistic infections can be respiratory system, which involves respiratory system like pneumocystis carinii, pneumonia, tuberculosis. Central and peripheral nervous system involvement causes cytomegalovirus, toxoplasmosis, non-Hodgkin's lymphoma, varicella zoster, herpes simplex. If it involves the gastrointestinal system, it will cause cryptosporidiasis, candida, Kaposi sarcoma. If it involves skin, it causes the herpes simplex, Kaposi sarcoma, and varicella zoster. You can see here the oral candidiasis on the tongue and the soft palate. Here, oral leukoplakia, the oral ulcers on the lower lip, labial mucosa, then Kaposi sarcoma on the chest, non-Hodgkin's lymphoma causing the intraoral obliteration of the sulcus. This is marginal gingivitis. The diseases because of the increase in the decrease in the number of CD4 cells, then salivary gland swellings, which can be appreciated also in advanced cases. In infants with HIV, there's a failure to thrive, persistent oral candidiasis, hepatosplenomegaly, lymphadenopathy, recurrent diarrhea, recurrent bacterial infections, and abnormal neurologic findings. Evaluation of HIV, how will we evaluate? So it remain undetected for years. Ways to diagnose it are fourth generation assay, like detect specific antibodies and P24 HIV antigens. Then rapid test use blood or saliva to detect an HIV infection within hours. Polymerase chain reaction, it can be the diagnostic or a confirmative test for HIV infection and can provide information about the viral load. Then when there is a possibility of acute and early HIV infection, the most sensitive screening immunoassay available, which is in addition to HIV viral load. Last is RT-PCR, which is most commonly used and which indicates the HIV. Treatment for the treatment of the it is actually related to the symptoms which is appearing on the body, as well as there are antiretrovirus drugs which are used to treat HIV, and they are used in various combinations which are referred as highly active retroviral therapy. It consists of nucleoside or nucleotide reverse transcriptase inhibitors. Then these are nucleotide. It is then next is fixed dose combinations. The combination of the above drugs together. Integrase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, and CCR5 inhibitors. Conclusion: oral health care workers can contribute to early diagnosis, prevention, and treatment of HIV. The oral health management of HIV infected patients should focus on the provision of dental care and treatment of oral manifestations of disease. Major concerns are impaired hemostasis, susceptibility to infections, drug interactions, and patients' ability to withstand the stress and trauma of the dental procedure. And treatment planning of HIV positive patients need to be carefully thought through and address numerous considerations. Thank you. Have a nice day.